I've never told this story before, but I will. Um, I was on duty the night that my wife Ann went into labor with our first child. And so, quite surprised and anxious, I called the chief resident to say I need coverage so that I can go be with my wife. And his answer was, no, you're on duty. Now, I appealed that and eventually went to my wife's side to enjoy the birth of our first child. But I remember the tearing sense of this instruction that there was a contradiction between my duties to my patients and my duties to my family and myself. That's not okay. That's not a kind of culture we need to build. Unless we take care of ourselves, as Rohini said, we cannot take care of those we serve. Luckily, I don't think that would happen today. But that idea of the needs of the patient come first, which is the rule for us, does not mean that our needs are subordinated to the level of the kind of ultimately violence that we're talking about in this session. Lest you want to add an economic side to this, it's smart business. If you believe that your leadership of organizations depends on meeting the patient's needs, you can't do that unless the workforce has the robust support that they then need to offer to patients. Another personal comment, my wife, Ann, had the unwelcome experience of open heart surgery in the midst of the pandemic, and I watched a symphony of effort. I am so grateful, as she is, to the techniques of the surgeons and the intensive care people and the nurses. But as we watched that workforce mobilize to get her through this challenge to her life and limb, uh, everyone mattered. And it was the compassion of the work of the housekeepers and the people that cleaned the room and the practical nurses who showed up at the bedside, learned her name, talked with her every day about her children and grandchildren. They added so much, and they could not give what they did not have. There were people who must have had the experience with support that allowed them to give Ann and me the support we need. Now it's time to stop the talk and move to action.